Hi, everybody. We're just going to give a couple more minutes before we get started because the screen is still filling up. Just giving just a 30 more seconds, folks, and then we'll get started. Hi, everybody. We'll go ahead and get started. You will have just me and Renee today, although I think, Renee, would you like to introduce Jana to everybody?
Yeah, great idea. Thank you. Jana Darlington is our new physician relations liaison. At least in my view, she's in the square next to me. Jana comes to us from the Center for Community Health and has just a really rich background, has her MPH. I should let her do this talking and not me. But we welcome Jana. She's succeeding Kevin Kelly in the position, and you'll all get plenty of opportunity to work with Jana in the new role. So Jana, pop in and say hi if you have anything you'd like to share.
Nothing to share, just really happy to be here and looking forward to working with you guys. So let's go.
Thanks, LJ.
No problem. Thank you. I was glad Jana showed her screen because that's always like, I'm looking for somebody who's live on there. It's an exciting day, right? It's an exciting week. We are going to be talking about vaccination today and pretty much just about vaccination for children. Chad is not able to join us today, so I'm so sorry. I'm not nearly as entertaining, but we're going to talk through this, and I love Janet Cranshaw's message. Yay, the 5 to 11-year-olds, absolutely. So as you are all fully aware, approval is here now for the 5 to 11. Many of you have started reaching out who have actually received some of your vaccine shipments saying, when can we start? It is my understanding that we don't start vaccinating until the final word comes from New York State. And I have Steve Cook, I'm driving him crazy right now, just asking for him to let us know if he gets the earliest notice on that final announcement from New York State. But I know that so many of you are already scheduling visits for your patients' clinics, visits in your practice, and that is a really good thing. So wanted to take a moment just to talk about the partnership with the county and the counties, plural, in the Finger Lakes region that have happened in order to assure that kids have the most access to vaccine as possible in support of our primary care teams doing this work. So just to reiterate, those of you, everybody should have received messaging around this, but in Monroe County. Monroe County is partnering with primary care to offer some centralized vaccination sites that will be specifically for patients from your practice, for those practices that choose to participate in that. You will work with us to get a link, and it's a scheduling link that you will complete for your patients that can go to that centralized site. It will include a contract with the county for reimbursement around those patients that are referred for that administration fee that would normally be coming to your practice. It does require an ambassador from your practice team, a clinician who can be there to greet families, answer questions, and to make it clear that this really is about your practice and your patients. We are excited about this opportunity. We're grateful for the county. I know that many of our teams that had hoped initially that we could just distribute bodies all over the place to be able to help with vaccination in practice settings, but recognizing where we are right now, that short staffing is in existence everywhere. What we wanted to do is do the most efficient and streamlined model possible that would, again, increase access to vaccine. Just to update you all on outlying counties in the Finger Lakes region have been doing a terrific job partnering with many of you whose practices are there, either to distribute vaccine or to coordinate centralized sites. I also wanted to compliment so many of the teams who some of our smaller practices are partnering with larger practices to assure that their patients get vaccinated. It is like all hands on deck, full collaboration and cooperation, I think, across the region, and that is just good for kids. Within the hospital systems, we know that Rochester Regional's teams are working with their hospital-owned practices to provide vaccination for their kids. Within URMC and Golisano Children's, they are doing the same, and at the same time are doing at least some centralized vaccine clinics as well. But for the most part, we wanted to have less confusion. And so those clinics are not open to the general public. We're really trying to have patients connect with their primary care teams to be able to find what the best pathway is for them to receive vaccination. I would add a caveat to that, which is in recognizing that the children who are highest risk, who we want to make sure are getting COVID vaccine early, are our kids who have complex medical conditions, chronic medical conditions. So we are working with the specialty teams at Golisano Children's within Golisano Children's Hospital to provide some additional vaccine opportunity for children who receive specialty care, particularly those who are not able to access through their primary care provider, or who may not have access to a primary care provider at this time. So again, lots of, it's parallel play, but it's coordinated. And anybody who's a pediatrician will understand that it's we're all sharing our resources a bit and sharing our toys, but trying to streamline the processes as we all work together. And that's one of the hardest things to coordinate ever, but I think it's really good work, and it's the way it needs to happen here. The other parallel players out there are the commercial pharmacies. And so just a reminder to your teams, it took until yesterday till we had this confirmed, but Wegmans is immunizing for 5 to 11-year-olds. Walgreens is also immunizing and is already scheduling for 5 to 11-year-olds. We know that CVS pharmacies will be doing that, but we haven't heard if they're scheduling yet. And my understanding is it may be certain locations. As we get that information, we're happy to share that, because I recognize, it's sort of three populations of families and caregivers that we're working with, right? There are the people who wanted the vaccine 6 months ago, and will take the earliest spot that they can possibly get. And then there's the population of patients who don't want the vaccine and may never be convinced. But then there's that middle population, right? It's the families that have questions or uncertainty, or maybe they want to wait just a little bit. And that's where I know you all in your primary care practices will be really doing a lot of the work, a lot of the answering of questions, a lot of the reassurance and confidence building for families. So The last thing I just wanted to mention, I'm going to ask Kim Povic if there's other things that she would like to add, or Renee, just about specifically around the vaccine effort is, Elizabeth Murray, I'm not sure if she's on right now, but was speaking on a Goldstone Children's Hospital call yesterday and talked about the fact that the next 48 to 72 hours will probably be a time where there's the most disinformation about vaccines for children than we will have ever seen before. And so it is really, really important that our community recognize that this is a unified effort, that we really support vaccine as important and safe for children. And so if you have questions that are being asked of you or something that doesn't seem quite right, don't hesitate to reach back out. If you want us to, if there's someone that you need some expert information from, we can connect you, or we can provide that through some of the team with Golisano Children's. I know we're all experts in this space, but it gets really tough when certain things are put out there and you're trying to tease out what's truth and what's opinion. I'll just put it that way. So there is some good reference information right on the Golisano Children's website, a series of FAQs and some nice material that were developed through the Pediatric Infectious Disease team and Golisano Children's Hospital. So if you need to reference that on your own websites, you can. Renee, if it's possible to pop that into the link that we sent, or the email we send out today, just so people have that, that would be great. And the last two things I'll just say is lots of people have been asking questions about consent form, if there's any change to the consent form. We have not seen anything specific yet in terms of changes to the consent form. So if there's consent forms that you have been using for your 12 and up, at this moment, it appears to be the same. If there's anything different in that, like, again, we're waiting for some specific guidance from New York State around that. We will make sure that you are apprised of those changes. And I'm looking at Kim. Kim, what else would you like to add to the conversation here?
I do apologize, I jumped on this call a little late. So if this news has already been shared, my apologies for the repeat, but I just got confirmation from the county that we do have vaccine. Was that already an update?
No, I just got it on my phone. So I'm glad you said it. My phone just buzzed and I looked down because we have been waiting at the county. We have been waiting. I know individual practitioners here have received vaccine when they were ordering directly, but yes, we were waiting for county vaccine. Thanks.
So, yeah, wonderful news. We have vaccine for Saturday. We are almost fully staffed as well. So we'll be ready to rock and roll for these clinics. We're very excited to work with the pediatric practices and get these kiddos vaccinated.
So for those of you who reached out requesting some help in terms of vaccination at the central locations, being able to do this partnership with the county, we are reaching out to you individually today. So please expect a call from Renee and myself this afternoon, checking with you to see if you would like to direct some patients to these county sites. So we will be reaching out to you today. Just want to make sure that people were clear about that. And I see that there's messages that are coming up in the chat. So Renee, do you want to, I'm going to take a look at that really quick. And then if you want to talk a little bit more.
Sure. My items are pretty brief, just to want to pass along some of the things that we'll be including in today's email update. There's new guidance coming from New York State Medicaid on vaccine administration. So some new information probably about coding and billing on that. And then there's some upcoming webinars and events that we'll have info for tomorrow, November 4th from 7:30 to 8:30 p.m. There is a webinar that's New York State DOH about pediatric vaccine and boosters. And we'll send you the link to that. And then Friday, November 5th, HRSA is hosting a vaccine town hall, specifically discussing pediatric COVID-19 vaccination in underserved communities. So we will include links to those two webinars and the PDF as well that came out from DOH on the, New York State Medicaid on vaccine administration. So those will be in today's email. That's everything that I had.
Awesome. So the messages that were in the chat are a little bit, I'm going to go backwards in them because we're talking about vaccinations. So there was a question about whether there's been communication to school nurses regarding post-vaccination fever. I would remind everyone that through the schools reopening safely task force, there was information shared about what are typical symptoms that could be attributed to post-vaccination symptoms as opposed to symptoms of COVID. We will resend all of that information again, and we'll include it in our messaging from today. We've sort of reposted it a few times. There's no reason for it to be any different for the younger kids than it was for the 12 and olders. So it's really, fever within the first 24 hours is felt to be reasonable. It's more systemic symptoms that are persistent that are concerning. So I'm paraphrasing right now because I don't have it right in front of me, but we'll send that around to you and that will be communicated to all of the school nurses. But different people have posted other opportunities for vaccination at pharmacies, et cetera. And then there is a question that is around testing for COVID. Just clarifying, if a patient has tested positive for COVID, how long did they continue to test positive? So this is one of the things I wanted to come back to around testing. We know from watching hospitalized patients, the elderly patients, who were waiting to be able to be discharged back to a nursing home or rehab facility, that they can continue to test positive for a very long time. And so really releasing from quarantine is all based on the timing and improvement in symptoms. So that's, after the 10 days, if someone has fully been in isolation and then their symptoms are improving, they are released from the county. And it is really important to note that if a child or an adult for that matter then develops symptoms again within the 90-day period, a 3-month window, they do not need to be tested again. Their natural immunity and protection is solid in that space. So we talked about those things back early in the pandemic, and then we sort of revisited them during different surges. But I think it's very important that information has been reshared to the schools again, as well to school nurses. If there's a child who was positive for COVID and they're showing up in the nurse's office or in your practice with symptoms that could be COVID, it's within that 90-day period. You do not need to retest those kids. That is not necessary. So I appreciate the question, and hope that is clear. Other things, Renee, I'm just trying to find our agenda. Anything else that you wanted to touch base about specifically?
Did you talk about MISC?
No, so I will just put this out there. So I hate putting things out that aren't definitive. There is conversation at the state level that there may be some nuances around whether a patient who had MISC should be considered for a vaccination in that 5 to 11 year age group. So I would just ask you all, we don't have information. They're discussing it actively at the state right now. So if there is any qualification around this or any question, I would right now encourage just consulting with Peds Cardiology, because those patients would have been hospitalized, and Peds Cardiology and Peds ID can make recommendations on individual patients. If there's a global statement that comes out about that, we will share it with you. So I was hoping we would have final information about that, but we have not yet. It looks like there's another question in the chat that just came up. The timing of testing after exposure, and that's a private one to me, so you all cannot see that. So Janet Cranshaw and her team have asked if we still should be following a certain time frame for testing after exposure. And I'm assuming that this means for someone who is in quarantine. Janet, I don't know if you can unmute or answer in the chat there. Someone who has had an exposure and is quarantined, and when is the best time to test for those patients? So this is a bit of a mess right now because there's information that has come out from the state that has not been affirmed yet in any way by the county, that there may be an opportunity for patients to go back into school, be released from quarantine at the 7-day mark with a negative test. So I'm going to just put it out there that we're going to have to get back to you on that, because we are waiting for whether the county is going to change from their 3 to 5 day recommendation to a 5 to 7 day. There's a discrepancy there right now. I would encourage practices to stick with what Monroe County is saying, which is 3 to 5 days after exposure, recommending that testing. And as soon as that changes, if that changes today, we will include that in the messaging as well. I love being the go-between for other people's stuff, but that is where I am at right now in this space. There have been many times during the pandemic that either the New York State guidance or county guidance has not necessarily been exactly like CDC. And I know this is something that they're actively looking at right now. So I hope that helps. Doesn't really help answer the question, but to give you a little more information. So with all of you on here, I am just curious, is there anybody who has additional questions, concerns? I'm hearing from a lot of you about where you're at in terms of trying to get ready for vaccination. And again, as we said, we'll be reaching out to all of your individual teams to just touch base about the county option over the course of the day today. Anybody else have concerns, questions, or just want to get back to having maybe a brief lunch before launching right back into everything? You guys are so quiet. It's an exciting time. This is a good thing, right? This is a big hurdle, but this is a really important time for our kids. We are doing our best to promote patients reaching to you all in primary care to get guidance on where they should or when they should get their COVID vaccination. That messaging is coming out of Gossamer Children's. There will be a press conference, I believe, either later today or tomorrow with the county. And so I just want to say publicly how much we all value how hard you all are working and what you're doing to try to stand up vaccination in your own practice or guide your patients to a space where they can get vaccination. And if anyone is running up against an unanticipated hurdle in this process, please don't hesitate to reach out. I think that's our role here, is to just try to facilitate connection to resources for your teams. So we really appreciate everything that you're doing. Last words, Renee? All right. I think we're done here. Everybody have a great day.